My name is Randy Bigley. Joining me on the podcast right now from Ohio Eye Associates, Dr. Sarah Nye Brunner. Good morning.
Good morning. How are you today?
I'm great. How are you?
I'm loving this weather. Ready for summer.
So am I, exactly. And with summertime, speaking of which, allergies, right?
Absolutely.
Yeah.
So I will say one of the biggest problems, especially in Ohio, especially as we approach spring and fall, everyone's coming in with, the dry, watery, itchy eyes. You wake up in the morning, they're a little gritty.
Right.
Worse when you've been out mowing the day before. And so a lot of times they think they have an infection. And it can present as an infection, but it's usually allergies. The problem is if you don't treat the allergies and you're rubbing those itchy eyes and you have bacteria on your hand, then you get an infection. And there's some really good ways to treat it over the counter to help yourself. So if you've been out mowing, you can put a cold wash rag on your eyes, and that kind of calms down some of the allergens. And also there's some good over-the-counter drops like Pataday or Aloe that work really good. What you don't want to use, and is really, really bad, is like Clear Eyes Get the Red Out.
Okay.
Those are like nose sprays. They are vasoconstrictors, so they constrict the blood vessels. So your eyes look nice and white, but they don't treat the allergies, and you can get addicted to them.
Okay. Really? I didn't know that. Yeah. Wow. Okay.
Yeah. So of all the drops, you always want to kind of avoid that. But there's like Pataday and Aloe are really good. They're safe to use long term, twice a day. And they'll really get rid of that itching.
Yeah, right, yeah.
And burning and some of that stringy snot that you get with the allergies too.
I think some people worry about when they get to I got pink eye or something. Yeah,
right.
Yeah.
Well, and pink eye is kind of that like generic, or conjunctivitis, that generic term. And actually, even when we're doing our coding, there's different types. Like it's allergic conjunctivitis or allergic pink eye. So, I mean, that is... You have bacterial, which is that classic green goopy stuff. And then you have that viral one that, like, I swear everybody this winter has kind of suffered from now that we're out and about and the head colds have been going around.
I had it. Yeah, I did.
Yeah.
My eye was all matted one night.
I know. And usually if you just do a warm compress, it kind of passes. So, but, I mean, obviously, anytime you're in doubt, contact your eye care provider, and they are more than willing to see you. But if you know you're prone to those allergies, using the drop can help. Sometimes we think that using, the Zyrtec and the Claritin, the over-the-counter ones are going to help, but sometimes they don't help the eye allergies, and they cause our eyes to be a little drier. And if our eyes are dry, because what does an allergy medication do? It dries us up.
Yeah.
So if my eyes are dry, I'm more prone to allergies. So I always say you can still use those over-the-counter allergy drops with your Claritin and your Zyrtec too.
Okay. Stay away from like Visine and all that too.
Yes. Anything that says get the red out is bad.
Right. Yeah.
So,
all right.
But,
so, if someone is interested in your services, how can they do that?
they can contact us at 419-756-8000. Had to think of our phone number. I guess I don't call it. Or they can stop up. We're up the road at 129 South Walnut Street. It's in the old People's Bank building, and we're in Monday through Friday.
All right. Sarah, thank you so much. I'm glad
Thanks
that you
for
took your
having me.
time in between patients and all that to come see us.
Thanks for having me.
Thanks so much. We will talk next time.
Thanks.